Welcome to our last and final lecture. In this lecture, we will be discussing the nutrition care process and non-pharmacologic intervention for PKU. So as we previously discussed, newborn screening is conducted to detect PKU since there are no true signs or symptoms that identify the disorder when a baby is born. However, upon positive diagnosis of PKU, there are various components of assessment that are congruent with the PKU diagnosis. So it's important to consider family history or any genetic testing that indicates PKU-related mutations. It's also important to identify if there have been behavioral issues since birth, such as signs of hyperactivity or aggressiveness. And also if there are any neurological problems, such as seizures or tremors. Some possible physical findings could be bare skin and hair, and this is due to the failure of phenylalanine to transform into melanin, which is the pigment responsible for our hair and skin tone. So oftentimes you'll see in the individual who is affected by PKU that they have lighter hair and skin than the rest of their family members. There's also a notable musty odor, and this could be in the breath, skin, or urine, and it is caused by excess Phe in the body. There's also a likely chance of skin issues such as eczema, keratosis pilaris, and scleroderma-like plaques. There could also be light sensitivity, other eye abnormalities, as well as hair loss, and there could be stunted growth, especially if the PKU has gone untreated. Now, there are biochemical tests that can be run to go along with the PKU diagnosis, such as serum levels of both phenylalanine and tyrosine, and it's also important to evaluate vitamin and mineral statuses such as iron. Now, in all of this, it's important to remember that the greater amount of time that has elapsed from a positive screening of PKU until the initial assessment, the more likely that these manifestations will be present. In terms of growth, it's a common misconception that infants with PKU will not develop normally. However, as I previously mentioned, this is really only an issue among those who go untreated or do not comply with nutrition intervention. A baby with PKU who has been treated since a newborn age is expected to grow much like any other infant or child. It is important to keep in mind that all babies do grow at varying rates, but if you notice stunted growth or microcephaly in an individual with PKU, this could be a sign of elevated serum Phe. That's why weight, BMI, fat-free mass, stature, and head circumference are going to be closely monitored in infants with PKU just to ensure proper growth is occurring and that the healthcare team can intervene if needed. So since uncontrolled PKU can lead to neurologic deficits, monitoring the behavioral development of the child is also essential to making sure that the disorder is well managed. Verbal, physical, and behavioral abilities will be closely monitored in younger children, and their social abilities and intelligence will be assessed as they grow older. Again, a child with PKU that is managed correctly should develop at a pace similar to any other child of their age group. This also includes food introduction. So food will be introduced at the same general age group as any other infant. However, it's the types of food that will be what differs from a normal child. And this is what we're going to talk about for the next portion. So as you know by this point in our lectures, PKU is really unique in the sense that dietary intervention is the gold standard of treatment. So once the diagnosis of PKU has been confirmed, treatment should start immediately. It will be vital to work with the family, parents, or caregiver in initiating a low-Phe diet and the importance of maintaining it. So during infancy, a Phe-free specialty formula should be the primary source of nutrition. Breastfeeding or baby foods can be utilized in small amounts in conjunction with the Phe-free formula, since it is still necessary to obtain certain levels of Phe, as it is an essential amino acid, but the Phe-free infant formula should be the priority. As the child grows older, low-Phe foods should be incorporated as a source of calories, and Phe-free medical foods and formulas can be used as well. So in terms of designing a low-Phe diet, there is a handout in Toolbox 2 that identify foods to be eliminated, avoided, or included on a low-Phe diet. So this will definitely be helpful for you as you move forward with this objective. Also on the right, You can see an example menu for a child with PKU compared to a normal child's diet. So this may also be helpful for you to get an idea of the restrictions. And as you'll likely notice here on this slide, the main restrictions are going to be in those high protein foods because foods that contain protein also contain Phe. So it's important to keep up with these amounts of Phe consumed daily in order to be sure that everything's being monitored correctly. If this is started early on, the child will have much greater chances of complying with this diet as they grow older. It's also helpful to keep a food diary, especially for the healthcare team, as this is going to support compliance of treatment. Approved food reference guides are an extremely useful and reliable tool in order to see how much Phe is in various foods. It's a good idea to pick a PKU food reference guide and stick with it, but if you don't have one on hand, there is an exchange method, which is a great way to calculate about how much Phe is in a certain food. So just for reference, 1 gram of protein has on average about 50 milligrams of Phe, and then 15 milligrams of Phe is equal to 1 exchange. So from that, we can conclude that 1 gram of protein is equal to 4 exchanges. And we say 4 because it's necessary to round up in these instances. And that's because a food label, could say it has 0 grams of protein, but it could actually still contain up to half a gram. So in these instances, it is more acceptable to just play it safe and pay attention to serving sizes. And just remember that all foods are not created equal, even if they are essentially the same item. So if calculating Phe intake or keeping up with a food diary seems intimidating, which it really might to most families, it's great to know that there are various apps available which are made specifically for monitoring Phe intake. We've listed a few of these here for reference, and these can be used just to make dietary compliance and accuracy much simpler for families, and it's really just a great resource to utilize. So as we've talked about in the last few slides, it's clear that the diet is quite restricted. And because of this, supplementation of various forms can be an important aspect to consider for an individual with PKU. Phe-LNAA and Phe-Block are 2 types of supplements that contain large neutral amino acids, and these can be added to a medical food in order to help reach and maintain target levels of Phe. So more specifically, Phe-LNAA is a blend of amino acids, vitamins, minerals, and is actually free of Phe. It can be used in patients with PKU and hyperphenylalaninemia who are aged 8 years and older. And it's also fortified with nutritional additives that can be deficient in the PKU diet, such as B12 and DHA, and we're going to discuss this later. And then Phe-Block is a supplemental tablet that can be taken to improve compliance with the dietary prescription and can also relax some of the restrictions while maintaining the goal levels of Phe. And it's a blend of essential amino acids and large neutral amino acids, and this can be used in patients 12 years or older. Next, the whey protein glycomacropeptide, also known as GMP, is ideally suited for the PKU diet since it is naturally low in Phe. It can be added to nutritionally complete, acceptable medical foods and beverages to increase the variety of protein in the PKU diet. And since it is an intact protein, GMP improves protein utilization and is said to increase satiety compared to amino acids. And I know this has been briefly mentioned in the previous lecture, but medical formula and foods are also available, and they provide essential nutrients that PKU patients cannot get through their diet. So these are just really important because they are nutritionally complete, they contain little to no Phe, they're high in tyrosine, and they meet RDIs for vitamins and minerals. Now there are also low protein foods available, which everyone heard about at the pediatric intensive course. So we know that these are available for patients to have certain foods that they might miss, or if they're just having trouble meeting caloric needs. But it is extremely important to discuss the fact that these are very expensive and they might just not be practical for most people. So as you can probably imagine, there are various nutrient deficiencies that can potentially occur in individuals with PKU. Some of the most notable ones are iron, zinc, selenium, vitamin D, pyridoxine, B12, folic acid, and the essential fatty acids DHA and EPA. When you see this list, you can most likely identify food sources that you would normally recommend in order to obtain these nutrients. For example, with B12, you'd probably say meats, eggs, dairy, etc. With the essential fatty acids, you'd probably say fish is a good source. And that's right, but all of these animal sources are prohibited in the low-feed diet due to their protein content. So it really is easy to understand how these nutrients are at risk of becoming deficient, just like you might expect in an individual following a vegan diet. So with that being said, it's important to monitor these statuses closely and explore the need for supplementation when necessary. So here are just 2 questions that will help to test your understanding of the information that has been provided to this point. So here I just recommend that you briefly pause the lecture, work through these, and then come back for the rest of the lecture. So for the next part, as you can imagine, the parents or the caregiver's role in treatment of PKU is extremely imperative. Since this disorder is discovered through newborn screening, it initially falls as a responsibility on the family to learn how to manage this for their child until they're eventually able to do that for themselves one day. The more closely diet intervention is monitored while the child is young, the simpler it will be for the child to continue to comply with this once they are of age. So around 3 years old is when a child develops an increased desire for independence, even though they are only able to provide a small amount of care that they actually need for themselves. But even at a young age, it's important with PKU to involve them in food choices and food prep and allow them to also help with counting phi so that it can become natural to them and ultimately so that they can feel empowered in their ability to manage PKU. Sometimes parents can compensate by offering sweets or other treats because they feel that their child is being deprived of food experiences. As the child grows, though, the family should encourage appropriate food behaviors and will grow to acknowledge that this is their new normal and that their child simply has a special diet. It's important to always treat these patients as any other child would be treated. These children, for the most part, require the same caloric needs and will grow the same as any other child as long as they are complying with this dietary management. So all aspects that we just discussed regarding parent and child's role will be continually emphasized and encouraged by the healthcare team. The healthcare team has a very unique role in PKU due to the close-knit nature of this, since it is a lifelong journey. And there can be a variety of healthcare professionals comprising the team, just depending on the patient's specific needs. Now, of course, if patients do not comply with treatment and dietary interventions, they will end up seeing their healthcare team much more often due to the nature of the disorder. But overall, this dynamic between the healthcare team and the family is quite often very positive. So each child will be continually monitored to make sure that their PKU is being managed well and that there are no complications. Of course, both phi and tyrosine will be checked. Compliance to the low-phi diet as well as consumption of formula or medical foods will also be assessed. And with this, it's necessary to make sure the child is receiving overall adequate energy intake and then adjust as needed. They will also be screened for vitamin and mineral deficiencies and adherence to any supplements. Also, their growth and developmental patterns will be continually monitored to make sure that they are progressing at a normal rate. So in summary, PKU is an inborn error of metabolism in which the body cannot properly metabolize the amino acid phi, and this becomes toxic. So it's diagnosed through newborn screening, and levels of greater than 4 milligrams can be an indicator. There are 4 types, and as you've learned, the greater extent to which these phi levels build up in the blood will cause better or greater cognitive deficits. So throughout our lectures, we've discussed various methods of intervention. Although there are some pharmacologic interventions, the gold standard is dietary intervention. The diet can also be supplemented with various nutrients if deficiencies develop due to restrictions. So you've reached the end of our lecture. Now with the information you've learned, you can move on to the next portion of our module. Thank you.